Hello, everybody. Welcome back. Good afternoon. Hope you enjoyed Dr. Haynes' presentation, and we'll get ready to start with Nadine Gaab in just a minute or two. Hey, Nicole, I have 2:15, so if you want to do the honors, that would be great.
Sure. Hi, everyone. My name is Nicole Chick. I am a Vermont member on the IDA-NNEA board, and it is my privilege and honor today to introduce our next speaker. Nadine Gaab is an associate professor of education at the Harvard Graduate School of Education. Her work focuses on typical and atypical learning trajectories from infancy to adolescence, with a special emphasis on language, reading, and literacy development and the role of the environment in shaping these trajectories. Her work is at the intersection of developmental psychology, learning sciences, neuroscience, ed tech, and educational policy with a learning disability framework. Her research laboratory employs longitudinal behavioral and neuroimaging studies to characterize differences in learning as a complex outcome of cumulative risk and protective factors interacting within and across genetic, neurobiological, cognitive, and environmental levels from infancy to adolescence. Her theoretical work focuses on multifactorial frameworks of learning differences with an emphasis on early identification and preventive education. One important key aspect of her work is the translation of research findings to address contemporary challenges in educational practice and policy. She is the 2023 recipient of the Academic Research Recognition Award from the World Literacy Foundation and the 2019 recipient of the Learning Disabilities Association American Award for her work on learning disabilities. Furthermore, she has received the Normand Geschwind Memorial Lecture in 2020 and the Alice Garside Award in 2017 from the International Dyslexia Association for outstanding leadership in advancing the science and advocacy of dyslexia. She also received the Alan Crocker Award in 2018 from Boston Children's Hospital for advocacy on behalf of children with reading disabilities and efforts around the passage of the Massachusetts dyslexia screening legislation. She is currently an associate editor for the Journal of Learning Disabilities, Scientific Studies of Reading, and Developmental Science. Furthermore, she is the co-founder of Early Bird Education, a gamified platform system for identifying children at risk for language-based learning disabilities. Thank you so much for being here, Dr. Gaab.
Yeah, thank you so much for having me today. It's a big honor. I was just telling the organizers that I'm actually in Brazil right now, doing some work with the Ministry of Education here as part of a conference. So it's really interesting to be in Brazil and speaking in New England, where I'm usually based. So you can find the slides here with the QR code, so you could scan it, and I will also have it at the end of the presentation. Okay. So I really like to ask this question: when does reading development start, to my audience? And so I want you to take, a couple of seconds, maybe chat with, someone next to you, and really think about, when do children start learning to read? When does reading development start? So usually when I ask this question in the live audience, I get all kinds of interesting answers, right? So sometimes I hear, well, it starts the first day of school, right? And then people pause and say, no, wait, maybe it starts when the kids learn their letters. Oh, no, wait, when they learn their sounds, which then they match to the letters. And so it's a really interesting question. And it brings us right to, the idea that, reading development actually starts in utero. And so in my lab, we see reading development as the start of utero. Because the fundamental milestone for learning to read are, language and sound processing, and they start as early as in utero. So if you look at the timeline here, after this, you have to learn right after birth which sounds belong to your language versus other, or languages versus other languages. You're learning the meaning, of, the sounds put together, words. You're learning the structure of your language. And the pragmatics, so when to use language in a social context. And then years later, let's say at the age of like 3 or 4, maybe 5, someone is asking you to map these sounds that you've been listening to since in utero to graphemes, right? After that, putting these sounds together, deciphering the code, decoding, reading single words, reading sentences. And the ultimate goal of learning to read are, reading with, good automaticity, hopefully good prosody, and most importantly, comprehending what you read. And so if you think about this timeline I just laid out for you, it is very clear that learning to read is a very, very complex skill, right? And so it has the developmental timeline with different, milestones, but it also requires explicit instruction. Right. And it's also important to, to think about that shift from explicit instruction to just, assuming that you know the skills. So, there's a shift from learning to read to reading to learn, which usually in the US happens maybe at the end of, 2nd, 3rd grade. It really depends a bit, where we stop actively teaching how to read, more or less, and just assume that everyone is reading, and then we use reading as a tool to convey a language and to, give us word problems in math and instructions for homework. So if you don't, read by the time the shift happens, that can have tremendous implication for, your, outcome, not just in the English language, arts. So to summarize, learning to read is a process that requires the mastering of a series of developmental stages in response to, active, instruction. And so it's not a natural process. It's more like learning a musical instrument, right? Where, you can listen to Mozart all your life, but when I put you in front of a piano and I say, no, you play, it's going to be, very difficult without explicit instruction and a lot of practice. So I think we need to shift our thinking from, oh yeah, learning to read happens in a short period of time. There's nothing before, formal schooling, and it's done at one point and then we can just assume it's there. No, we should just see it. Yes. Oh, as a complex a process as it is, and that it starts as early as it does.
Lily wants to help you.
So the really, important piece here that we are, following throughout this conference so far, I heard, is the reading rope, which illustrates what I was just trying to, explain to you. So, as you know, at the end of the rope, we have skilled reading, but then we have that, what I often call the mechanics of learning to read, which is the word recognition process. So the phonological awareness, the ability to manipulate the sounds of language, decoding, doing sight word recognition, and with sight word recognition, we are not meaning, a list of sight words that you have to memorize. We're meaning you are adding more and more words to your repertoire that you can just identify by sight. They can be decodable or not, which, increases automaticity. And then we have that oral language piece, which we've been, practicing since in utero. And so both strengths are extremely important and have to come together. So just, one example. So you could be a really good decoder, right? So your strength could be in the word recognition piece. But if you don't understand, or, you don't know the meaning of the word that you just deciphered, you just decoded, it's kind of useless, right? If we go one step further, you could be a really good decoder and you could have a really large, vocabulary. So let's say you can decode all the words in a complex sentence and you know the meaning of all the words in isolation in a complex sentence, but maybe, during your upbringing, you never encountered complex sentences, for what reason ever, or you have problems with, sentence comprehension. And so then, despite your good decoding, despite your good vocabulary, you will struggle with reading comprehension because you don't, understand how the end of the sentence relates to the middle of the sentence, relates to the beginning of the sentence. So this just illustrates some of the aspects that are so important in that oral language piece. And to summarize, when we talk about early identification, if you talk about screening, if you talk about assessment, if you talk about, good evidence-based instruction, we need to start thinking about, all the way back to in utero, and thinking about like, what are, the milestones that start long before these kids enter my classroom, or long before, they're, being screened in an educational setting. And, we have to make sure these are included in our, assessments, in our teaching practices, in our evaluation, in our teacher training. So to look at, this evidence I just presented to you, it's, all part of the science of reading. And so the science of reading is a big buzzword right now. And so I wanted to start with saying what it's not. So the science of reading is not like a philosophy or an ideology or a new idea or a trend, and it's not a political agenda, even though a lot of people try to politicize it. It's not like one specific program of instruction or a single specific component of instruction, such as phonics. What it is the body of evidence that tells us, based on the research that has been done for over 50 years, how proficient reading and writing develops, why some have difficulty with it, how can we most effectively assess and teach, and therefore improve student outcome through prevention, intervention, and prevent reading difficulties altogether. So it's similar to, something, like the vast body of climate change, or a vast body of like, mental health, applications that, are based on the sciences. So I'll just leave this here in your package as a slide that's, really powerful and just illustrates how much more literacy is than just, the grade you get on your ELA or the score you get on your screening, right? So it's really, an issue of poverty and child labor and food and access and, social justice, etc. And so every child has the right to learn to read, but, as we know, from many longitudinal assessments and US-wide studies, 67% of all fourth graders in the US are now reading on grade level, and approximately 80% of fourth graders who grow up in families of low socioeconomic status backgrounds are reading below grade level. So I'm confident to say that we have a reading crisis in this country, even though some people do not want to say this out loud. What's also important is that 70% of below average readers in first grade remain below average readers, and reading with children with reading difficulties in third grade are likely to struggle throughout their entire educational career. It has also tremendous implication for your duration of education and if you drop out of high school or not. So we know that struggling readers are 4 times more likely to drop out of school, and African American and Latina children who are struggling readers are twice as likely as their white peers to drop out before high school. So that has tremendous impact. So you often see repeating grades with increased risk of dropping out. Students with disabilities often are more than twice as likely to be suspended, and it makes a lot of sense because you're just so frustrated that everyone else can figure this out and you can. And if you're prone to like show externalizing behaviors, you may just throw a chair or stab someone with the pencil because you don't know where to go with your frustration when you're a young child with like still developing social emotional skills. Dropping out, justice involvement, not pursuing any post-secondary education, and high rates of unemployment. What's also interesting is if you look at, and this is from the National Center for Learning Disabilities, 48% of parents believe that children can grow out of their learning disabilities. 78% believe that any child can do well in school if he or she just tries hard enough. 18% of parents believe that children with learning disabilities are less intelligent than other children. So there's a lot of myths surrounded by it, a lot of things that we could prevent if we just find kids early and intervene early or give them the right tier 1 that they need in order to learn to read well. And so we like all of this would be irrelevant because we would try to prevent the struggling reader. If you look at social, emotional, and mental health outcomes, the picture is even darker. So we know that if you have problems with learning to read, you often have low self-esteem really early on, right? So you were the king on the playground, running the fastest. Suddenly you start school, everyone else figures out how to read, you can. That has tremendous implication for how you see yourself as a learner and how motivated you are to learn in general and to go to the school thing that makes you not feel good. And so that sticks with you. And so we see externalizing behaviors, we see higher rates of anxiety, depression, and we also see a lot of vocational and economic impacts later on in adulthood. So I like to show this because, and I say 67% of fourth graders are not reading on grade level. It's not that 60% of fourth graders have dyslexia, right? So that's really important to keep in mind. So we can see the reading disability under an umbrella, but there's different, causes. There is dyslexia, we'll talk about it, but you can also struggle with reading due to, poor instruction or, environmental circumstances. We'll talk about it, maybe you have problems with expressive receptive language skills, etc. So I don't want to focus so much on the different causes because, in the end, it doesn't really matter because we need to find these kids who are more, the higher risk to struggle with reading, regardless of where it comes from. And we need to help them to learn to read. So, that whole debate of different subtypes and causes, etc., maybe, really relevant for, intervention, etc., but it's less relevant for, making the case for screening or, good, instruction in tier 1 or good alignment between tier 1, tier 2, and tier 3. So what is dyslexia? It affects about 7 to 10% of children. It's a specific learning disability with a neurobiological origin, and it's characterized by difficulties with accurate or fluent word reading, okay, which also can go with poor spelling and decoding. So if we go back to our wonderful robe, which is the topic of your conference, dyslexia can be defined as the children who have struggled with the mechanics early on, right? So they're struggling with the decoding of these single words. It doesn't mean that subsequently they won't struggle with reading fluency or reading comprehension because it goes hand in hand, and it doesn't mean that they cannot show also problems with language. And we even have a study showing that if you struggle with learning to read, that has an impact on your vocabulary over the years compared to a group of children who started with you on the same level of vocabulary skills but are not struggling readers. So there's a lot of interaction between the different strands of the robe. and people have critiqued that about the rope. So, but, you know, if we talk about dyslexia, we are often also saying, you know, word reading disability, compared to, you know, like reading fluency or reading comprehension, you know, problems, because it's the word level that we're, you know, seeing as the main challenge. So what are the factors contributing to atypical reading development? So we have genetics, the brain, perception, cognition, and environment. So in the 80s, in the 90s, you know, people really thought, and, you know, I can completely see based on the literature, you know, why, you know, we thought this, that there's maybe one cause that causes kids to, you know, struggle with learning to read. And the big contender was phonological processing, phonological awareness. And people were really trying to like focus on this and trying to intervene. And so I think we moved a little bit away from the idea, not from the phonological awareness, but from the idea that there's only one cause and one factor that influences, you know, if someone is a good versus a poor reader later on. We are now seeing it more as a multifactorial model. So where, you know, all these factors here in pink on the left, you know, interact with each other and then can cause atypical reading development, right? But it's not like just one cause. It's more like a combination of all of these things together. So to look at genetics, and I'm not going to spend too much time on it, but you know, I could probably say this with high confidence, there will never be like a dyslexia test that is, you know, DNA-based genetics test. But the field has shown us, which is really interesting, is two things. So first of all, we know that, you know, it runs in families. So if you have an older sibling or a parent with, you know, word reading problems, dyslexia, you have a 40 to 60% chance to develop dyslexia yourself. The second interesting thing that we learned is that these genes that have been identified as being susceptibility genes, so somewhat associated but not directly causing dyslexia, are involved in early brain development as early as in utero. So we go back to our timeline. So the idea here, one hypothesis is that there are some dyslexia susceptibility genes in some families that lead to atypical development of very, very early brain structures in utero, which later on makes it more difficult for you to learning to read. If we look at the environment, there's been a lot of great research related to this. So some of them are here on the slide. So, you know, trauma, you know, stress related to immigration status, neighborhood factors, inadequate reading instruction, caregiver with substance abuse, et cetera, et cetera. So these are important factors. And there is some screeners under development that are trying to incorporate some of these environmental factors in addition to some of the behavioral assessment that usually are within screeners. So let's look at the brain. So learning differences are often not identified until childhood or even adolescence, but, you know, diverging trajectories of brain development may be present as early as prenatally, bringing us back to the in utero timeline. So, so if we go back to the rope here, we've been thinking a lot, and we are writing a paper right now on how can we expand the rope to the left of the timeline, meaning like how can we actually start in utero, and thinking about some of these strands here that are open and look like someone just cut them off and bring them all the way back, you know, to, you know, the early beginnings of skill development of reading. Okay, so let's look at the brain. So on the left, you see a brain, and you can, you know, from the left-hand side. So the purple part is here more in the front, and the red part is here more in the back. And these are the 4 key areas of the reading network. So that doesn't mean there's only 4 areas, and it doesn't mean, you know, it's only happening on the left side. But, you know, these are some of the key areas. So I'll, you know, quickly introduce them to you as well. So in red, we have the, you know, we call it, or Stanislav Dehaene called it, the letterbox, which is actually recognizing letters and words, right? Very important. And interestingly, it's explicit instruction that drives the specificity in this area. So the area, the structure is there all along, but it does something completely different when you're 2 and you're not, exposed to letters yet. But then exposure to letters and recognizing what a letter is versus an object versus, or door handle versus a number, increases the specificity in this area. And so if you go to your next cocktail party and someone asks you what you do for a living and you're an educator, you say, I change brains on a daily basis. So the orange part is the oral language part, which brings us back to the row, brings us back to in utero. And the green part here is the mapping from the oral language onto, the letterbox, right? So we have this, what I often call a triangle of early reading, where you have that connection between letters, oral language, and, the mapping of the three. And so that's, often what explains really well why we need phonics and why it's really important early on, because it builds that, back part of the reading network. And then later on, we know it's connected to the front CEO, I call it, of the reading network, because it does what the CEO does in a company. It does a lot of deciding what is important and what's not, integrating into a bigger picture, reading fluency, reading comprehension. And these brain areas somehow have to talk to each other and convey information, right? So if the letterbox wants to convey information to the CEO of the reading network, that is done through these long axons or highways. And so one that's especially important for language and reading is in red here. It's called the arcuate fasciculus. You don't have to remember this, but for today, we'll just call it the arc. So I'll show you a video now, and I want you to carefully look at the sequence. And this is a video of a brain reading, an adult brain. And so and I play it again and again, but what's really interesting is to see how it starts in the back. You could almost see like the triangle of early reading. It goes over the letterbox, like this is primary visual, just seeing in general, then your letters, then the oral language, and then it goes to the CEO. And so looking at this, illustrates again how complex reading is and how we ask kids in a relatively short period of time to coordinate all of these brain areas in order to, decode words. This reading network I just introduced to you is, very universal when it comes to different languages. So we see a very similar network, for Spanish, English, even Hebrew, which is, different alphabet and different reading direction, as well as Chinese, which is a logographic language. Research has shown that, if you struggle with learning to read and you're in elementary school and you've already been diagnosed or identified, we can, compare to kids who do not struggle, we see differences in brain structure, function, and also the highways like the arc that connect the different brain areas. What we didn't know for the longest time is how early these brain differences are there. And so, what we've showed and others as well is that, the brain differences we see in struggling readers are not a result of struggling on a daily basis, but they predate, or at least some of them predate the onset of reading instruction, meaning that these kids step into the first day of kindergarten with a less optimal brain for learning to read. So that has tremendous policy implication because, if they already start school with a less optimal brain for learning to read, we need to find them then. We don't need to just wait 2-3 years and just make it worse and, think about the vocational economic outcomes, but, most importantly, the mental health. And so there's a series of studies that, for instance, this is our famous arc here again. We showed that the volume of the arc, the microstructure is related to phonological awareness in the first 6 weeks of kindergarten. We could show, if you have a strong familiar risk, so an older brother or sister or parent with dyslexia, you see differences in this arc as early as pre-reading, and, it's very much the same areas over time. time, we could see that the development of this arc, is much faster in good readers compared to poor readers. And we, even went all the way going back to infancy, because we believe reading starts in utero, and looked at, some of these brain characteristics in infants. And so here you can see my wonderful, collaborators and the babies who were part of this study. And so we followed these kids now all the way to middle school, and we just submitting an NIH grant today. Well, I'm in Brazil, but my team is and trying to see them even longer, and trying to see, can we connect some of these early language networks in infancy to subsequent reading comprehension outcomes, in 8th grade. Just to show you, how long we've been doing this. So this year in purple is my daughter, who is now in 8th grade. So it just shows how long we've been doing this work. So back to our arc. So you see 4 babies here with, an arc that we can measure with our brain camera, which has no radiation. It's just a big, wonderful magnet. And by the way, we are enrolling right now 4 and 5-year-olds, and follow them for 5 years for a study looking at the development of math and reading skills. So if you are in New England and you have a 4 and 5-year-old, or of 4 and 5-year-olds, or you're a kindergarten teacher, please send them our way. We're still enrolling, and there's lots of great, perks with it. We give like a detailed report each year. We have lots of resources. The kids, get, a little printout of their brain, etc. Okay. We also do this all over the world. I'm in Brazil right now, but we do this, for instance, in Bangladesh, and look at similar questions around the globe. And what we could show is that some of these brain alterations, for instance, some of these, changes in the microstructure of the arc are present as early as infancy. And then if you can look at infant, pre-readers, beginning readers, fluent readers, you can see a nice progression, but that the similar brain, areas seem to be, developing differently across, the different ages here cross-sectionally. We also followed these kids then, as I told you, and so we could show things like the left AF, so the left arcuate fasciculus, is measured in infancy, relates to how well your phonological processing and your vocabulary skills are, 5 years later, suggesting that, in infancy you don't have like built out, network for phonological awareness or even language, but it could be the scaffold is there, and the scaffold is not like, developing in a typical way in kids who subsequently struggle. And there's a couple other studies that came out from our lab where we looked at, how these brain areas talk to each other in infancy, and showed that this is related to preliteracy outcomes. You're giving more evidence for that idea of, long-term brain development affecting reading outcome. We're also really interested in the role of home literacy environments. And so with home literacy, we mean like the age of onset of shared reading and the frequency and quality of book reading, parental language, during shared reading, because some of this has been shown to actually shape this arc, the microstructure and the arc. So for instance, research has shown, like from Rachel Romeo and John Gabriele, that how many conversational turn you have with your 4-year-old, so 3-year-old, is related to how strong the microstructure of that arc is. We could also show that home literacy plays an important piece in or is related to that development of this arc. Okay, so let's look at some of the key policy awareness milestones since 2000, where we are today. So there's been the National Reading Panel, No Child Left Behind, IDA-NNEA, so that these were all put in place in order to, improve reading outcomes. I mean, there was like, bigger, questions and goals behind it, but that was one of the goals. And so let's look how well this worked. So here on the bottom, you have from 1992 all the way to 2022, assessment years of the, nation's report card or these NAB reading scores. And if the average fourth graders, or the average of all fourth graders measured, which is, representative nationwide, would be, like a proficient level, these bubbles will be up here where the line next to the 240 is, where it says NAB proficient. But the average is below this. This is where the 67% of fourth graders are not reading on grade level comes from. What's more important in this graph for today is it hasn't changed. Look at this, right? So, like you can go back even more, but like going back, like it's been 217 here and it's been not moving the needle. What's also really important to keep in mind here, it's not COVID, okay? So if someone tells like, oh, the reading scores are so low because of, that we had COVID, right? We need to like still have recovery. Well, the recovery is great, but I don't want you to recover back to, 220 because that was like, low as well. So I want you to recover and go beyond, the 220. So I think that's really important to keep in mind. So what we often currently do is that when it comes to learning differences, we are largely focused on a reactive, deficit-driven way to fail model instead of the development of preventative approaches, right? And so let me give you a bit background on this. So currently, we have what we call a dyslexia paradox. So you struggle with learning to read, and you struggle a little bit more with learning to read, and a little bit more. And so still in 2023, most kids get a diagnosis or the start of intensive intervention, and I mean like a tier 3 or so, and not some RTI in between, the end of second, beginning of third grade. However, research has shown that the window for the most effective intervention is way earlier, right? And the reason for this is because the brain is more plastic for language the younger we are. So, it's much easier to learn a second language or third language when you're 4 than when you're 40. The gap between the good readers and the poor readers is, not there yet because everyone is sort of like developing in pre-K. And so, that's why, the window for the most effective intervention is way earlier than we currently diagnose, which, we have termed a couple of years ago the dyslexia paradox. And I put some of the references in here showing you, some of the evidence that the effect sizes are much larger in the younger grades when it comes to, intervention in the later grades, and that you can actually prevent dyslexia or any reading disability with just, attending to it early and doing the right thing. And if you look at all of these studies from the science of reading, look at when they were published, right? So it's not something that, the science of reading suddenly came up with in the last 5 years. No, it's been around for like 25, 30 years. And, somehow it did not make it into the classroom or into like even the conversation within the field of education until now. So how can we move from a reactive to a proactive preventative model in education? So we do have some good evidence from the science of reading. What are the early behavioral predictors of reading difficulties and dyslexia? And these include phonological awareness, or the ability to manipulate the sounds of language. So it can be, very early on, I give the child, 3 words and ask them which 2 of the 3 sound alike, like head, cat, bottle. Which 2 sound alike, right? So that is, the phonological awareness or processing, and it can then develop over time. And it's really important that it's not like, 2 categories, either you have phonological awareness or not. It's a developmental skill, right? So it can go from, tell me 2 words sound alike, pre-rhyming anything to, say the word fixed without saying the sound. Right. So, it's important to keep that in mind, that, kids developing differently and are on a timeline of, development of phonological awareness scales of phonemic awareness. Pseudo-word repetition, so giving a word that follows the English language rules but isn't, has no meaning, and asking them to repeat it. It taps into short-term phonological memory. Rapid automatized naming, which is naming something that you're highly familiar with, so like objects or colors. Some people do it with letters, depending on the age, again, developmental skill. And see how fast can I retrieve the label out of my memory. That helps really with the sight words, right? So, let's say you decoded, the word, car, you read it like 20 times, and at one point it becomes like a sight word. You just look at it and it's car. And that process for you to like suddenly knowing this is car, I don't have to sound this out, requires rapid automatized naming, because you're retrieving something from, memory that you're highly familiar with. Vocabulary, letter knowledge, letter sound knowledge, and oral listening comprehension. So these one, like the vocabulary and the comprehension, like mapping nicely on the upper part of the rope, and some of these mapping more onto the lower parts, and some are sort of like, not represented much in the rope. Also, familiar risk of dyslexia, we discussed this already, or like a history of language delay, play really important roles, as are these environmental factors we discussed earlier. You probably noticed there is no vision on that, right? And so I think it's really important to communicate this out to the public and to our parents that vision problems do not cause dyslexia, and there's no, letter switching or, like vision therapy or color glasses that can help us. So how can we solve the dyslexia paradox? So I would like to introduce you to the analogy of preventative medicine, which will help us to understand preventative education. So we as a society embrace preventative medicine, right? We really do. We like checkups. We do like vaccines, or taking vitamins, or getting a mammogram, right? So we're doing all kinds of things that help us not to get sick, right? We are preventing from getting sick. So it's something that usually it's not discussed widely, because people just embrace that preventative medicine is a really good thing to have, so people don't get sick. And they don't have to pay for expensive hospital stays because of heart disease or anything. So let's say you go to your doctor, and the doctor says, okay, we're checking your cholesterol today, and your cholesterol comes back as being high. So you don't get a diagnosis of heart disease right there, right? And so the doctor says you have high cholesterol, and that's gives you a heightened risk to develop problems with your heart. So let's do something preventative right now, with the goal that you never develop heart disease. So, you do exercise and change your diet, maybe take some medication, and then the ultimate goal is you don't develop heart disease, right? So it's very cost saving as well, because you don't have to go to the hospital, and you don't have to skip work, etc., because you prevented, your heart disease. It's the same idea with screening, right? So we do comprehensive early risk screening. So we identify children at risk. We don't give them a diagnosis when they're in pre-K or K. We're just saying this child has a heightened risk to develop problems with reading. So let's do something right now. And, it can be something within general education. Doesn't have to involve special education or anything super costly. It requires good teacher training, good tier 1 instruction. There could be some tier 2, and then the ultimate goal is to prevent having reading difficulties, like we prevented the heart disease. So or you have, if you still get a diagnosis, it may be less severe, because, you already did all these preventative, approaches, beforehand, and started early when the brain was still very plastic. So that's the whole idea behind, screening and, solving the dyslexia paradox. So if you think that this is like a genius new idea, it's actually not. So the science of reading has already come up with this a really long time ago. So this is a paper from 2001. And, you know, I just want you to pay attention to this gray box here, which says special education professionals and programs should become a source for preventative interventions. So that was 22 years ago. Right. And so this is a great paper and, you know, could be written last week. And so finally, I think, you know, whatever, you know, we identify in this paper that I explained to you so far, you know, makes it into the field of education, and we have legislation and some approaches. So talking about legislation, this is actually an older map. So if you want a new one, you can go to this link here. But now we have California on board since like a couple of weeks ago, and you know most of these states are now blue, I think, except for Alaska and Hawaii. Anyway, so we now have legislation, but you know we still have a long way to go because you know it's not enough if you just screen everyone for high cholesterol and you say like, great, you know, I know all these people now have, you know, high cholesterol, they're all at risk to develop problems with their heart. If you don't do anything about it, or if you don't have skilled, you know, professionals who help you do something about it, it's kind of useless, and it's just, you know, costs a lot more. And so, you know, it's important to have that, you know, in mind, that we need to like, you know, implement it and have really good, you know, teacher training and, you know, improve the screening measures and, you know, improve tier 1, which can already do a lot, all part of that preventative approach. And so you can find some really great ideas and approaches like at the Massachusetts Dyslexia Guidelines. There's some really great work done in the Right to Read report from Ontario, Canada. So here are some recommendations that are, you know, very, you know, similar to what we discussed. So this one here from, you know, says it recommends that the results of early screening be used to identify students at risk of failing to learn to read words adequately and to get these children to immediate, effective, evidence-based interventions, right? So, you know, it doesn't really matter where it comes from, you know, the Right to Read report or, you know, legislation, as long as it's implemented. And so we've done, you know, a number of, you know, things in order to get this out there. So this is, you know, a report we did, you know, with UNESCO. There is some really great resources on the National Center on Improving Literacy related to screening, so that you can actually explain this to all stakeholders involved, parents, special educators who often think like they're gonna get, you know, overwhelmed with all the at-risk children. It's actually the opposite. They would only get the kids who are really still struggling by then, and you know, it's more like, you know, getting the right kids to the right programs. There's, you know, more work, you know, that we've done related to, you know, getting the word out and you know, also explaining how could that be done. So here you have some other resources related to screening for early literacy milestones, the why, when, whom, how, and where, that Professor Jakob Petscher and I wrote for the International Dyslexia Association. And we also developed the screener called Early Bird Education. And so I have a conflict of interest because it's a for-profit company that we put together 4 years ago. But you know, the reason we did this is to scale it up and get it out there as many kids as possible. But there are other really good screeners out there. I just wanted to like give you this as one example because I know it best. So this one here screens for all the things we discussed, and so the kid gets either on an iPad or a touch or a Chromebook, you know, clicks on an animal and then plays a game with this animal and the little bird here. His name is Pib, and then, you know, it's all adaptive. So if you are really good at it, it goes by really quickly, and you get different difficulty measures depending on your skill level. You know, you get like little rewards after you finish each of the games. And so here are just some examples. And so the whole system then comes with, teacher training before the screening itself. It has a rich dashboard showing you for each student, where are their strengths and weaknesses for each of these discussed skill, but also, give you teacher training and a whole platform related to working with one particular child or group of children, looking at videos and lesson plans and helping you group these kids. So it's a screening plus the evidence-based response to screening, similar to like the high cholesterol screen versus the going to do to get the cholesterol system. So we found on our website. So if you go to Gaab Lab Next Steps and Reading Instruction, we have a whole bunch of like videos that are also freely available and as part of this system. Okay, so let's look at the where. So we're working now a lot on embracing literacy as a community. So working with libraries, maybe they can help us to like start screening, and then maybe we can recommend, the kids who come back as being at risk to like maybe join a community group that works, in the mornings or afternoons on some of the skills. It could be related to one second. Yeah. It could be related to which kind of books they would recommend as part of the screening. So maybe the screening could come back with low phonological awareness skills, and you're like, oh, here are some books that you can read at home with your child, or here's a group on Wednesday mornings that you can join with your caregiver, that where we work on some of these skills. And so in addition to libraries, we are looking at, some other settings where this could maybe work really well. And one thing we do, push a lot for is pediatricians. So, yes, schools should do screening, but why can't we add the screening to pediatricians and have them, be part of early identification? So they currently screen for ADHD and autism, but they don't screen for learning disabilities, and they argue because it requires not a medical next step, but an educational next step. But we say, well, it doesn't matter because, given the strong implication for mental health, we believe, you should know about this, because, if a child is suddenly showing, high anxiety that wasn't there before they started school, it's just part of the whole child approach. And so we, have more and more pediatricians who are interested in this on board. And we developed also, with the help of many experts, including Charlie Haynes, who I heard spoke before me, screening like a new test. It's not a test, it's like a screening checklist at this point. It's called the Sprout. And so the idea here now is that this should be digitalized and validated so that it could be reimbursed by insurance, but we're trying to find some funders who can help us to do these next steps. And so that's what I'm working about. And we are doing this in many different languages. So, one reason I'm here in Brazil right now is we have a Brazilian, collaborator, network, and have the checklist in Portuguese as well as in Spanish. We wrote this part to say how this could work in social work context or any other health workers that come to the home. And also really thinking about this global neurodevelopmental perspective instead of just staying in our little bubble within our state or the US. And that we already talked about this. Yeah. So to summarize, the ROBE is a really important framework that illustrates some of the important pieces that need to be put in place in order to be a successful reader. However, my critique is that it, sort of starts way too late developmentally. And so, we're working on a rope that goes, further in the younger ages. And so it will be really important to then, emphasize some of the skills that you need early on within the screening approach and the evidence-based response to screening. So today we talked about genetic factors and brain level and perception, cognition, and environmental factors, all interacting with each other prenatally all the way to postnatal development, and can lead to atypical reading performance. And so to conclude my talk for today, so the development of reading proficiency is a public health issue. And, you know, the right to equal education includes the right to read. And so, you know, we know that literacy is so important for academic, social, economic, and vocational outcomes. And the National, you know, Academy of Medicine in a recent summary highlighted that the duration of education, as discussed, which is highly dependent on reading proficiency, is a significant predictor of health and longevity, almost as significant as cigarette smoking or obesity, especially in the younger grades. Okay, I'm happy to answer some questions. And here's the QR code again. And let's all work together to increase, you know, the joy of learning to read in all children. Thank you.
Thank you so much, Nadine. This was amazing. We are so happy to have you. And I am looking in the chat to see if we had any there. Christine, if you see any, or Susan.
I'd say early on, right before we all got started, there were some of the questions coming out of the Hoover chat were about students with sort of that atypical brain over time with strategic and intensive intervention. Can we make the brain through neuroplasticity resemble a sort of a typical reading brain?
So are you saying, like, do we actually, you know, if we do early intervention, does the brain then look typical after that? That's a really good question. So there has been some studies showing that, you know, you can definitely make it look more typical. But then I think we should, you know, walk away from the idea that there is one ideal brain for learning to read, because you know, we have some studies that I didn't present today showing that there are kids who, let's say, have a really strong familiar risk to develop problems with reading, but they develop perfectly fine high reading skills. And what we found in their brains was actually that they were utilizing both hemispheres, and that their reading network looked very different from like a traditional reading network. And so we are now looking into this and almost calling it like compensatory strategies that could be in the environment, could be in the, you know, child's cognition and perception, but also in the brain. They could explain why some kids, despite a higher risk, you know, develop typical reading skills. And I think we can learn a lot from this, which then can inform, you know, what can we do preventative, but also in the response to, you know, problems to, you know, but I think we should walk away from like the ideal reading brain and think like, you know, what could be some alternatives. And so I think we don't know as much about this yet.
It's amazing. I wrote down so many things. I have to get a new notebook, but I just love the quote when you say, what do I do for a living? I change brains, right? Or something like that. So
yeah, no, I like this a lot. So I you know, I really want to, if you do this, you know, send me an email, say how people react. But you know, that's what you do. I mean, we do it as parents too, not just as educators, right? But especially as educators, like every time you sit there and you know, teach a new letter, or like to teach sounds, or how the, you know, sounds go together, like all these, you know, different skills, you know, think about the reading brain and think about the different brain areas, you know, being involved, and how you, like, through you teaching, you know, create the development of these, you know, networks, which then are used lifelong to, you know, read text and enjoy text.
And I also think of the sense of urgency that we all need to have, and, you know, especially in the younger grades, when kids are as young as we can to get them. So, all right. Well, we want to thank you so much, Dr. Gaab. We are just amazed at all of your work, and we appreciate you.
Yeah, thank you very much for having me today. And greetings from Brazil.
Yes. Thank you
So much. All right.